Hi everyone, good afternoon. So, hard task. So, yeah, welcome to this presentation, designing covered agentic AI workflows for healthcare delivery. So, my name is Thomas Bosnai. I'm principal consultant at Catalyze Data. We are a company out of the UK, near Oxford. And so this presentation is around a bit coming from the hackathon entry that we did under the name Dement AI, and you could see our CEO back on stage earlier this afternoon. So our footprint includes financial services, insurance, public sector, life sciences, pharma, and healthcare to an extent as well. I myself have no healthcare background. So what we are going to see today is just generally how AI or agentic AI can help in healthcare, and then kind of the prototypes we did for this hackathon in terms of agentic AI workflows, implementation in SaaS, in terms of design considerations, and practical examples. So how can AI help? So diagnostic precision is definitely a thing that AI excels in. So agentic AI can help in that one as well. It can also optimize treatment pathways to ensure more efficient and timely care. It can help healthcare teams adhere to protocols in a more consistent way. It can also improve patient engagement, which can lead to better health outcomes if trust is improving as a result of that. A bit overlapping is enhanced patient communication. So just think about how large language models or agents can help in communicating with the patient and removing burden from the actual human workforce teams, and that also can lead to more timely communication with the patient, which again leads to more trust and helps in engaging with the patient. It definitely can improve a lot on clinical documentation, and in general, augmentation of healthcare teams is certainly a thing that AI can help in. So if it removes the low value-added tasks from the actual workforce so that they can focus on the more risky and more value-added tasks, that definitely can help. So a bit more, so certainly AI-powered diagnostics is a thing these days, not just machine learning models, but AI can help in diagnoses. For example, reasoning models can reason what the machine learning or computer vision models are diagnosing from the medical records and unstructured data. Hyper-personalized medicine is more a bridge to kind of consumer apps where, based on the health indicators the patient can have, AI-driven apps will personalize whatever medicine can be suggested to those patients so that it can help finding better pathways. Remote monitoring is again a thing that is being driven more and more by AI with smarter devices, but providing the same quality of measurement. Remote monitoring can be made ambient. Drug discovery accelerations. I'm sure you have heard across the last couple of days how much drug discovery can be accelerated using AI with SaaS technology. That certainly is a thing. AI is being used more and more to answer health questions. So just think about frontier model providers creating health versions of their models, such as ChatGPT Health, Claude Health, and so contextualized models definitely can help providing medical suggestions to patients. Healthcare navigators and concierge services, so these can help in finding the better pathways for the patient through the healthcare operators, and also finding those actual healthcare operators based on the medical measures or health indicators of the patient. The models can predict what a potential disease or symptom they have is, and then point the patient to the right healthcare operators. And then also AI scribes is a trend, at least this year, that is coming more and more prevalent. So how to implement that in SAS? So you will need certainly large language models, and they can be used remote in their original kind of endpoints if you're not really concerned about sensitive data. But in a health setting, you would be most likely be concerned about that, so you'll use them in an enterprise environment in like private containers, and there's many ways to do that. But if you consider small models, then you can host them and run them locally. You will need also machine learning models. So I guess you can list many methods to build machine learning models. Maybe each of you can mention one new that you have learned across the last couple of days. But as you name it, it's obviously SAS code, Python code can be used in SAS to build machine learning models, but also Model Studio gives a nice interface to do that. What also comes handy is text analytics and traditional natural language processing models that can be used in agentic AI workflows, and they're also available via Model Studio, for example. So once you have these models, the machine learning models, text analytics, and the LLMs, you will likely need some sort of model repository, and model manager is acting as one, which can then act as a repository for certainly your machine learning models and text analytics models, no matter what language or what tool they were developed in. But also you can register your large language models in SAS Model Manager as well, just to provide governance. So once those are there, you will need some sort of orchestration layer, and SAS Intelligent Decisioning is one good example of that. And so with that, you can combine the machine learning models, the LLMs, with various other logic like human-in-the-loop rules and rule sets. And then if you want to then productionize this, then you would think of some sort of enterprise integration or just an app interface. So one potential use case from our Demant AI entry is basically an Alzheimer's diagnosis and treatment assistant agent. So instead of just using a machine learning model to directly inference from devices that track the the patient's recordings. As an example, we have put together a prototype agentic AI workflow that's consisting of a couple of different items. So we have these machine learning models that mentioned on the hackathon entry, can predict the risk of Alzheimer's disease based on EEG recordings. We've also used other machine learning models that predict the risk of Alzheimer's based on audio recordings. We've also created medical text extractor processes using visual text analytics, and we've also used LLMs in a couple of ways, like to augment and explain the outcomes of the previous items, and also we've used rules as in treatment protocol rules in terms of what needs to be coming up for the patient. And so the whole scenario here is an autonomous workflow that generates a preliminary report for the practitioner before an Alzheimer's disease patient is coming in for consultation. So a bit around the implementation in SAS. So SAS Intelligent Decisioning is used to kind of create and govern the agent logic via a decision flow. and then that uses various building blocks. So you can use DST processes to, for example, retrieve data and manipulate data, but another very important building block of these flows are the Python code files. So in this example, we've used that to interact with LLMs, and also to call the audio machine learning model, which we've used from Hugging Face. We then created this machine learning model using deep learning that predicts the risk of Alzheimer's disease based on EEG recordings. So that one we registered in Model Manager and used via a designated node in the flow. We've created the treatment protocol rules, so that's basically to come up with suggestions around what should be discussed with the patient and setting other kind of important parameters or variables in the flow. And so these have been all put together as this flow. And so at the end, a pre-discussion report is provided to the practitioner. So how to make this governed? The intelligent decision tool itself is providing nice governance based on its explainability. So the graphical interface gives a nice structural way of seeing what the kind of agent logic is. And then things like the context database and then rule file analysis provide nice ways of audit trailing and looking at where each kind of decision ended up. So let's look at another example, which is these AI scribes. So in this example, we've created a scenario of a team of agents which basically look at GP appointment audio recordings and then create medical documentation from it. So a couple of agents that we have created to this. There's a transcriber agent which basically transcribes the audio recording from the appointment. Another agent will summarize the text coming out from the transcription. We have used more deterministic tools, including a tool that extracts medical concepts, and then two specific pre-trained models, BioBERT and clinical BioBERT, which are used to do biomedical language understanding, and doing the same in a more clinical context. So we have used these tools, and then also another agent is being created to create SOAP notes. So the SOAP standing for subjective, objective assessment and plan. Another agent is extracting the different actions from the previous inputs that the other agents have created. And there's a medical coder agent which is creating FHIR compliant medical code. So that is part of the process to make sure that the medical records can be updated properly with the right categories. And then there's an agent reviewer which kind of reviews all the above information in terms of correctness to provide the final documentation in a readable format and also to record it in a database. So a bit more on the implementation. So we've used a modular flow built in intelligent decisioning, which means each agent and tool can have its own subflow. The rule-based text analytics, what you can see on the right, is a simple technique to create simple concept rules in Model Studio Visual Text Analytics, and so these can be run and flag various medical concepts and entities in the different texts that these agents are creating. And so these can be then used to kind of compare against what the LLM-based agents are suggesting and creating as outputs. So we have used these rule-based text analytics models and also the pre-trained medical models from Hugging Face, so the one called BioBERT and clinical BioBERT. So if you use a modular setup of the code files, then that will do a good job for you. So with ALMS, the prompts are quite important, so a good technique is to separate the prompts that you're using to call the different LLMs and separate that out from other logic, including the actual calling of the models. And so this way, if you do it right way, you can swap the models in and out, and that way it's again a modular setup of the whole agentic workflow. And then you can use branches in the workflow to separate different kind of edge cases, either where there's like some malicious input given from the transcription, or if there's insufficient information. So in that case, you don't want to create this final medical documentation, but rather flag the case that something is not sufficient. And then there is this medical coding agent that provides the regulatory compliance via creating the FHIR specific medical codes. So in this setting, if this gets then productionized, then clearly that will have PHI data and PII data as well recorded, which does not matter necessarily. However, if you want to reuse that data further for other purposes like fine-tuning these agents that you have created, then you would need to remove that data. And so there's a possibility to create separate agents for that one as well. So in this example, we have not tied this up to any enterprise system. So we just used an example app which can use to upload the audio transcription, and then that will fire off the whole kind of agentic logic, calling the decision flow, and then the various agents and tools will run to create their outputs. So there's the audio transcription, which also, so the agent which creates the transcription adds formatting as well, and so things like removing filler words, and also the agent is trying to identify the different speakers, and so that that way it can give a nice formatting for the transcription, so that's better to be used by the later agents. Then there's the summary agent, which creates the summary in terms of what has been mentioned. Next one is the notes agent, which creates these subjective, objective assessment and plan structural items of the notes, followed by the actions agent, so that extracts what actions the different actors need to follow on, either the patient or the practitioner, which is then followed by the medical coding agent output, which is creating these FHIR specific medical codes. So on this example, you may not be able to see, but it's like about shoulder pain. So the relevant codes are being retrieved there. And then finally, there's a review agent, which kind of reviews all the above information in terms of completeness and correctness, and that is being added as well. And so this is kind of a readable report, but in the scenario, this is being recorded to a database as well. Now, this whole thing, we have trained these agents not using real-world data, but using the PRIMOC data set or collection of audio recordings of GP appointments. And so those ones are relatively long, like a couple of minutes each. So this example here is just a shorter kind of generated example to see how that would provide this much shorter report. But so the idea is if such a thing gets productionized, then it's not just generated data, but people need to validate all the outputs with human in the loop. So that would be engaging with practitioners, GPs, to provide validation and benchmarking data on these transcriptions and agent summaries. So that way, we can then productionize this, because again, this was another prototype. So in terms of other governance artifacts that are available within SASVIA to help govern all the different assets that you have with these agentic AI workflows. So if you build the models in Model Studio, then when appropriate, then you can have model interpretation outputs and bias analysis as well. If you use Model Manager acting as a central repository, then that will govern all the models and providing various information around like model health and model performance using the model cards. And Model Manager also provides a kind of complete designated workflow which you can customize around the whole model lifecycle. So from the initiation of the model to recording that the model is being trained and built, then registering the model, and then approving it for usage, monitoring through its life cycle for performance and drift, and then decisions like retiring the model or retraining the model. That's all kind of built into Model Manager, into workflows that you can use or customize to your business needs and different types of models or different types of domains. Now, this is true for the kind of machine learning models or text analytics ones that you have registered into Model Manager. But the LLMs can be also registered into Model Manager, and then newer developments provide various information on the LLMs. So Model Manager, I believe, will, at least in later releases, able to provide much more insight on the performance of the LLMs and how they align with kind of the governance around the other models, the machine learning models. The LLM prompts and AI agent prompts can be managed not just in Python code files, but there are much better ways to do that. For example, either a SAS information catalog, or there is a tool called SAS Agentic AI Accelerator that is providing a full set of tools around the governance, guidance, and control around the LLMs and prompts, so that the idea is that like the prompts, how the different LLMs or agents are being called, that's being more domain specific to certain users, whereas other logic around the LLMs, like which model to actually call, is maybe more technical focused. So the right information is in the right place. So these new developments that you may have heard about that are coming up, these will all help in this process. On other artifacts that you have across your data platform, in this case, in SASVIA, there's the comprehensive lineage provided around various other artifacts that are being used in the whole ecosystem to to create these agentic AI workflows in the end. So that includes like data sets and ETL processes, visualizations created in SASVA, models built in Model Studio, models registered into Model Manager, and the intelligent decisioning decision flows themselves are all kind of accessible in one nice lineage view that provides you with the dependencies around these different artifacts. And the whole SASVIA ecosystem is ticking all the boxes to make it HIPAA compliant. So in general, certainly AI and agentic AI can help a lot in healthcare. And then there are many ways and flavors of how this can be implemented in SaaS. But certainly it can provide a governed and controlled way to control all these assets. And with all the developments in responsible AI, then this will be just getting better and better. So if you if you've looked at the demo of SAS AI Navigator, that then gives a complete governance solution around all your models, agents, use cases, and put this together in a nice solution that can be used to govern all these assets. All right, so that was it from me, and happy to take any questions if you have.